Panobinostat, also known as Farydak, is a medication used to treat multiple myeloma, a type of cancer. It works by slowing down or stopping the growth of cancer cells. However, it's important to note that this drug has been withdrawn from the U.S. market due to problems with its effectiveness. Always consult with your healthcare provider for the most up-to-date information on its uses and potential alternative treatment options. It is typically taken orally once a day, with food. The optimal timing for taking Farydak is something you should discuss with your healthcare provider. Before you start taking Farydak, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor. It is usually taken once every other day for 3 doses each week for the first 2 weeks, then stopped for 1 week. This is one cycle of treatment. Swallow the capsules whole with a cup of water. Do not crush, chew, or open the capsules. If you vomit after taking the medication, do not take another dose that day. Take the next dose at the usual time. Be sure to tell your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, and herbal products. Your doctor may stop your medication for a while if you get any side effects. Also, avoid eating grapefruit, star fruit, or pomegranate, or drinking grapefruit or pomegranate juice while using this medication unless your doctor or pharmacist says it's safe. These fruits can increase the chance of side effects with this medicine. Use this medication regularly to get the most benefit from it. Take it at the same time on the days you are scheduled to take the medication. It may help to mark your calendar with a reminder. Do not increase your dose or use this drug more often or for longer than prescribed. And if you are pregnant or may become pregnant, do not handle this medication or breathe the powder from the capsules, as it may harm the unborn baby. If you are taking Farydak, you may experience side effects such as nausea, vomiting, tiredness, loss of appetite, diarrhea, weight loss, swelling hands/ankles/feet, or weakness. In some cases, your doctor may prescribe medication to prevent or relieve nausea and vomiting. Eating several small meals or limiting activity may help lessen some of these effects. If any of these effects last or get worse, tell your doctor or pharmacist promptly. People using this medication may have serious side effects, but you have been prescribed this drug because your doctor has judged that the benefit to you is greater than the risk of side effects. Careful monitoring by your doctor may decrease your risk. Vomiting/diarrhea that doesn't stop may result in dehydration. Contact your doctor promptly if you notice any symptoms of dehydration, such as unusual decreased urination, unusual dry mouth/thirst, fast heartbeat, or dizziness/lightheadedness. Panobinostat may rarely cause serious liver disease. Tell your doctor right away if you have any symptoms of liver damage, including nausea/vomiting that doesn't stop, yellowing eyes/skin, dark urine. This medication decreases bone marrow function, an effect that may lead to a low number of blood cells such as red cells, white cells, and platelets. This effect can cause anemia, decrease your body's ability to fight an infection, or cause easy bruising/bleeding. These effects may be fatal. Tell your doctor right away if you develop any of the following symptoms: unusual tiredness, pale skin, signs of infection, such as sore throat that doesn't go away, fever, chills, cough, shortness of breath, easy bruising/bleeding, pink/bloody urine, black/bloody stools, vomit that contains blood or looks like coffee grounds, coughing up blood. Get medical help right away if you have any very serious signs of bleeding, including headache that is severe or doesn't go away, trouble speaking, confusion. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you experience diarrhea, abdominal/stomach pain, or cramping while taking Farydak, it's important to contact your doctor immediately. They may need to prescribe medication to stop the diarrhea or adjust your Farydak dosage. Farydak can also cause serious heart problems, so your doctor will closely monitor your medical and lab tests while taking this medication. If you experience any signs of heart problems, such as chest/jaw/left arm pain, fast/slow/irregular heartbeat, severe dizziness, or fainting, seek medical help right away. It's important to discuss any concerns with your doctor for more information. Before taking Farydak, make sure to inform your doctor about any allergies you may have. Also, be sure to discuss your medical history, especially if you have liver or heart disease, infections, bleeding problems, or blood disorders. Farydak may affect the rhythm of your heart, and it's important to be aware of the symptoms of heart rhythm issues, such as fast or irregular heartbeat and severe dizziness. Be sure to inform your doctor about any heart problems you may have or if you have a family history of heart issues. Additionally, low levels of potassium or magnesium in your blood can increase the risk of heart rhythm issues, so talk to your doctor if you have conditions such as severe sweating, diarrhea, or vomiting. It's important to take precautions to avoid infections while using Farydak, as it can make you more susceptible to getting sick. Stay away from people who have infections that can easily spread, and talk to your doctor if you've been exposed to an infection. Before receiving any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Farydak. Also, take caution to avoid getting cut or injured, and be sure to inform your doctor or dentist about all the products you are using before having surgery. If you are pregnant or planning to become pregnant, discuss this with your doctor before starting Farydak. Women using this medication should ask about reliable forms of birth control during treatment and for at least 3 months after the last dose, while men should ask about reliable forms of birth control during treatment and for at least 6 months after the last dose. It's important to talk to your doctor right away if you or your partner becomes pregnant while using Farydak. Finally, it is not recommended for women who are pregnant or may become pregnant to handle Farydak or breathe the dust from the capsules. Additionally, it is unknown if this drug passes into breast milk, so consulting your doctor before breastfeeding is essential. It's important to note that Farydak may interact with other medications you are taking, which can affect how it works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Certain medications, such as carbamazepine, phenytoin, rifamycins, such as rifampin, and St. John's wort, among others, can affect the removal of Panobinostat from your body, which may in turn affect how Farydak works. Be sure to discuss any potential interactions with your healthcare provider. Remember, it is important to take Farydak exactly as prescribed and at the recommended times. If someone has taken too much Farydak and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea, vomiting, diarrhea, and easy bruising or bleeding. If you suspect an overdose, seek medical help right away. It's important not to share Farydak with others, as it is specifically prescribed for you and your condition. Before starting Farydak and while taking it, your doctor may schedule lab and medical tests, including a complete blood count, ECG, blood mineral levels, and liver function tests. It's important to attend all of these appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember, as long as it's within 12 hours of your scheduled dose. If it's been more than 12 hours, then just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to Farydak, it's important to store it in the blister pack at room temperature and away from light and moisture. It's also recommended to keep the blister pack in the original carton to protect it from light and avoid storing it in the bathroom. And of course, it's crucial to keep all medications away from children and pets. When it comes to disposing of Farydak, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, it's recommended to properly discard the product and it is expired or no longer needed. For more information on how to do this, it's best to consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.